Let me see. I'll try to share my screen just to give some screenshots to start with. Share one of my screens here. Let's see here. All right, I believe everybody can see this now, right? Yeah.
Yep.
All right, so this is Humantiv, and this is the app that we will be releasing for beta testing. And we're going to start the sign up on July 1st. We're going to issue a release saying that we are launching this app. We do want beta testers, so this is going to be our first step, is to get the required beta testers. I don't know the exact number that we're looking for, but start getting all these people on board and launch this probably to download the middle of end of July. We're still trying to figure out that exact time, but that's the time frame. And let's just talk about what this is going to be. As you can see here, you can connect various data sources. We have now we're working with a particular API that offers a lot of different data sources. Nabil, what you think, maybe 30 or 40 different types of trackers and wearables and EHRs?
Yeah, so yeah, there's a lot of trackers, but also services, like you can see, 23andMe, for example. And then we can have also medical data. So quite a few sources.
Is that through a Validic or somebody else?
It's the Human API. It's a different.
Yeah, they're competitors. Yeah. And so I think from what I've gathered, Human API looks a whole lot better. They look like they'll be better in the future. So that's why we're looking at those guys. But the whole idea behind this app, let me back up a little bit for everybody that's not familiar with what we're doing. We're looking at healthcare as there's a reactive side of medicine, there's a proactive side. And we're building products to facilitate the payments on the reactive side when you do need to go to the doctor, a way to facilitate those payments in an easy manner. But also we're looking at the proactive side of health, being proactive in terms of trying to live a healthy life before you get sick, before you even need to go to the doctor. So that's what the idea behind Humantiv is. It's an app. It will be an operating system that runs a lot of our software moving forward, but initially it's going to be an app that you download. And this app is going to import data from various trackers, and it's going to give you a health score. And we're going to incentivize you with our cryptocurrency to improve that health score. So basically, we're going to pay people to go walk, to get better sleep, to stand up and not sit down as much, to go take the stairs versus the elevator. I mean, various challenges throughout the days and the weeks and the months, really to get people active. That's our main focus with this initially, is to get people up and moving around. So generally when people are up and moving around, they're going to be a little bit healthier. So that's the first step. And then the next step is to start getting more of these data sources in there, start incorporating genetics, start incorporating microbiomics and various other trackers such as wireless blood pressure cuff, your scales, and so forth, and also your medical records coming from EHRs, and really crafting a holistic view of your health at a given time and over the course of time. And with that, we've essentially created a personal health record. So now a user will have their personal health record on their phone, and they can keep track and keep tabs of their health and improve their health. So it's a really cool concept. There's a few other companies out there that have done something very basic, but also similar, paying people to go walk. And that's kind of the age-old thing, is your pedometers, and also rewarding people to go take those steps. And there's also insurance companies that are giving away Apple Watches to their beneficiaries just so they can track their health, and they reward from that. And on that note, John, I was going to ask you if you would share your experience with what you were saying this morning about how you track your steps and how you get a 10-point system that you can redeem for something.
Well, Brendan, I'm a little older than the average person on the phone here, and I'm a Medicare beneficiary, and I use a Medicare Advantage program that Humana provides, and they offer an incentive. It's unfortunately for their non-Medicare population, it's much smoother for us Medicare folks. I guess they figure because we're not tech savvy, little do they know. it's kind of a paper and pencil thing, but they offer a series of rewards for healthy activities, and you get to pick what you want, whether it's steps or heart rate or whatever. And then you, at least for the Medicare side, you actually have to fill out a form every day and then send it in once a month. It looks kind of like this. You see all the black dots? It looks like an SAT grid score, right? Well, that's very cumbersome, but the rewards you can choose from, and I choose an Amazon gift card, and for so many steps per day, you get so many points. What we're trying to do with Humantiv is obviously have that be more automatic, certainly not nearly as cumbersome, but it's an incentive. And I think if it's done automatically through an app like Humantiv, then people are going to participate. Besides the fact that it's although this particular method is cumbersome, it's fun to stay on top of what you're doing. I have an Apple Watch. It's pretty good at measuring what I do, heart rate, sleep, all the kind of things that are important and certainly impact your health. So I think the fact that we're able to integrate all these indicators is going to be really exciting and really helpful to people. Now, get credit for what you do. I mean, that's basically the way I look at it. Besides the fact you're going to stay healthier.
Mm-hmm. It's yeah, I think this resonates with just about everybody. I've looked at other apps and other similar concepts like this, and people say, look, I've been sitting on my butt for far too long, and now I get some incentive to go out there and walk, and I do it. It's changing my life. And that hits me hard when people have changed their behaviors based on a financial incentive to go move. I mean, that's powerful stuff. And there's multiple studies that show that people will always do stuff if you pay them. You know, that's like economics 101. If you're going to pay them to do something, they'll continue doing it. Hence the problem with fee for service. But having this as an app that will start to quantify your health based off of a lot of different data entry points, such as all your wearables, eventually our idea for this is to get to that clinically validated score where physicians can trust this and understand that, all right, this is an accurate representation of my patient's health at this given time. And if we do these procedures, this treatment, we can measure the outcomes of said treatment over the course of 6 months. So you can start to see how these types of medications and these procedures can impact a user's health. So that's where we're going with this, is we're trying to refine it to that point where a clinician can vouch for it and say, yes, we are going to use this as our measurement of outcomes. So nobody has tried to take that on yet. That's a pretty large endeavor. But I do see we're going to open source this up to more clinicians and have a type of a collaboration engine where a lot of different researchers and physicians, clinicians, anybody that wants to start tweaking this, or not tweaking it, but updating the proof of health algorithm to really get down to that accurate health score.
And I think that's what separates Humantiv from everybody else. It's a single score. And sure, we're still working on refining that. But if you have that single score as an indicator, and as you said, if all the things you're doing with your doctor to improve your health theoretically should make that score go up or down, whichever way we decide. But if it's improving, you should have a higher score. Nobody else is doing that. Everybody's doing track this, track that, but nobody's pulling it all together, and certainly not from nearly as many sources as we're talking about doing from. I don't know of anybody that's doing it from 23andMe. Nobody's pulling in that source, to my knowledge, on an app like this. So it's really an exciting time and opportunity to really give anybody, that knowledge of saying, all right, if I do these things that my doctor says, I should see my score go up. Obviously, if the app's right and the things that are being prescribed are right, that should happen. But again, we don't have anything like that today that I'm aware of at all.
And personally, the health score for me is more important than the reward, because rewarding somebody to improve their health is good, but they should know where they are and where they stand. And that score will tell them exactly. And beyond that, they can show it to their doctor. They can get advice, because I mean, if the score goes down or up, I mean, think about it like a stock. You know, if it goes really fast down, it's something is bad. You know, you have to do something. You have to do some actions, you know, to get it, you know, back up. And the interesting thing also is that we're using a lot of data sources, and that will allow us to actually figure out some correlations between data. You know, we have data of your sleep, and we have data of your, you know, and core temperature and of your diseases. Well, there might be a correlation there. I mean, you can data mine all this stuff and then figure out correlation in between things and suggest that to the users. I mean, other apps cannot try to do that, but with restricted data, like, you know, steps, heart rate, etc. A holistic view of the body is really, really interesting. And then there's a lot of challenges, actually. You know, one of the challenges, for example, is how can you quantify, how can you figure out the score of somebody who's an athlete and somebody else who has a chronic condition? You know, like we have to get some notion of customizing things, figuring out something we might call the limitations. You know, people have different limitations, and those limitations can be also quantified. You know, we can get that from genetics, microbiome testing. We know the, you know, the age, gender, the metabolism of people. We would know if they have pre-existing conditions. All of that will create that specific or custom, you know, score variation, and that's where, you know, the challenge would come, and then we need a lot of research. But we can make it really basic at the beginning, and then after that, really, really make it personal. And the more data you have, the more you personalize it. You know, if I get more and more data, I can figure out my, you know, my core temperature, my normal temperature, which is different than anybody else, you know, in this meeting, and which also changes, you know, through the day. You know, every hour of the day, my temperature is different. Things like that, where you gotta customize things and figure out all these baselines, and then adapt the algorithm to the person using the app.
Yeah. And Nabil, I agree. The simplest thing that comes up is always BMI. Like, if you take an athlete that's a bodybuilder, their BMI is going to make them look like they're obese.
Yeah.
It's muscle mass. So you just need simple context to understand certain data. The idea of boiling it down to a single score is super interesting. To John's point, I haven't seen anyone pull that off. But what do you need, like blood test data and like socioeconomic and like maybe mental health stuff to really round it out? Like, what besides just fitness stuff is what's in there today, and what's like the next 2 or 3 things you really want to add?
If you look at the determinants of health, you may have seen this poster go around, a little pie chart, and it shows what actually determines somebody's health. And if you look at medical care, you know, what we spend over $3 trillion on, it only makes us like 11% of what makes you healthy. You have about 38%. The largest chunk is for personal behaviors. It's what you decide to do, whether you decide to go to the gym, whether you decide to smoke that pack of cigarettes or not. You know, it's your personal decisions, your habits, and really just that the personal side of you. It comes down to your choices. And then you have like 21% is determined by your genetics and biology. I think you got 7% determined by your location where you live. And you got another, what's the other? Probably like another 21% is based on your position in life, like where your job's at, how much money you're making, your education level, stuff like that. So all those together, that's really your social determinants of health. And that's what we eventually want to get to. If you look at that score, if you want to, you know, factor in all those factors and create a score from that, that's really what we're trying to improve. So if you look at things that we could easily track now, such as stuff that we can get from your wearable and such, but now moving into the social determinants of health, that's going to be a lot of user inputted stuff. I think a lot of that could come from EHRs if we could just get a lot of that data from there. But yeah, a lot of this is going to be that the individual user wanting to improve their life, improve their health, and they will have to start inputting some of these manual data points, such as, you know, what is their education level, what is their salary level, where do they live at, you know, what is the pollution like there. So there's so many different things that we could factor into the score. It's going to be ongoing. I've said it a couple times. I mean, it could take a year, 2 years for us to finally get enough data and enough people to refine this the score down to being clinically validated, where people can rely on it. And it's going to take a while, but it's something that needs to happen, because I do see in the future since we have all this data, somebody is going to generate a score like this. So that's why I like that we're starting now to get it going, kind of crowdsource all the data and all the people. So yeah, it's going to be a work in progress. And
Ben, it's interesting that you mentioned mental health and all these other aspects of health. One of the things that I've been always wondering, and I've seen that with my friends, is incentive points, for example, work with some people, but not with everybody. I mean, if you're in really bad mood or depression, I mean, 100 Medits are not going to be, enough for you, but for somebody else, they're really attractive. So this idea of including also, other parameters that can determine what kind of nudge you can send to the user. Right now it's standard. Every app has, we send Medits, or we send a score, or some tokens or some rewards, but maybe there's more than that. Maybe there's things that we can do depending on the mental, the physical, the location of people. Geolocation will determine what kind of water you're drinking, what kind of air you're breathing, etc. All of that we're trying to put it all together. I mean, it's not easy, but we'll have to put it all together and figure out how to give a score for the user, but also how to encourage them.
Sure. And the idea.
It seems like you might have a whole different host of privacy and kind of like social issues when you get into those kind of parameters like mental health. So it might be harder to sell. Enter in your level of depression today versus enter in your steps, or tracking some of those other more less controversial measures of someone's health.
Yeah, I don't think we have to ask, what is your depression level today? And we could prompt them, how happy are you today on a scale from 1 to 10? What's your outlook on today? 0 to 10, something along those lines. Maybe some gentle questions along throughout the week that we can compile it together to get their depression level, if you will. And like, for instance, I think these always listening devices sitting on our tables and stuff, I think they're going to play a big part of mental health, because I've noticed the past couple of days I leave my office and I turn my lights off with said device over here. And the past 2 days, I've just been wore out when I leave. And it's just like, when I tell Alexa to turn my lights off, it's almost like, I caught myself last night. I was like, man, that sounds depressed. And I was thinking about having these devices listen to. I was like, man, that just sounds like I was wore out. And I started thinking, I wonder if you could look at that over the course of a year, and you can start seeing, oh, Brendan was really happy when he left. Brendan seems really down, and just kind of start going up and down. And I could see that playing a big part in mental health, having this assistant that will listen to you. I mean, they're not going to judge you, and they can hear your voice, and you can get a lot from a person's voice over time, how it changes.
Yeah, that's really interesting. I bet you could.
It's a good idea.
So I wanted to point out, hi guys, it's Grace. I just wanted to point out too that social isolation has been identified as a really big concern, aside from a mental health standpoint, that we are so self-involved or so isolated from everyone else, and just gauging simple, like, have you spoken to your family today, your spouse, your children? Have you, interacted with people physically at like a store or, in public? Engaging those simple measures is demonstrating profound insights, and also on people's well-being, that in any chronic disease or anything that has comorbidities, you can have the perfect treatment plan, but when people are isolated, they do so much worse than people who are out thriving. So I think it speaks well to all of the things that you're talking about.
Yeah, I would like to be able to almost incentivize that, getting out and associating with the environment, with other people, going out there to the grocery store versus getting your in-store pickup type thing, walking around and start interacting with people. I would like to measure that or track that or incentivize that somehow. I'm just, other than a manual input or some Black Mirror episode style, I don't know exactly how you would track that. That's going to be difficult to figure out. But yeah, I do think there should be nudges. Even if we don't have to track it, we should just nudge them. Hey, have you, we noticed by your GPS location, you haven't left your house in 4 days. Time to do something, go out there and interact with somebody.
Yeah, something simple.
Yeah, we could say, hey,
and I wanted
here's
to
100 minutes to go outside.
I wanted to bring up too. Have you guys seen the release on Fitbit for kids?
Oh yeah.
Yes.
Yeah, that's exciting. And I wanted to share something personal. So my children are going to summer camp at the local Y, and I just got a release form, a consent, where they are going to be given a wearable to wear during camp, and they're going to see and track their own data. It's called Active Science. I think it's awesome, and they're going to bring awareness and show them what different activities do for their heart rate or their steps, and why it is important for health and well-being and athletics, and why it's fun. So right. I just thought that was interesting, because this is a local community program that is doing this, and this is the first time I've heard of such a program where they're actually showing kids. My kids are 5 and 8. I think it's phenomenal.
Wow.
Because to bring that awareness,
that's really cool.
It's really cool. So I'm excited to see what the program is about, and I'm certainly going to be sharing along, because this is something that is really happening while we're brainstorming. This is taking part in the next generation of kids. So they're going to be just so second nature about this. I think it's a really, really exciting thing. Yeah, absolutely. And then you think about the data and activity and tracking that longitudinally and consistently. There really could be powerful insights there.
There's a related thing called I just put it in the Slack called UNICEF Kids Power Band. You guys have heard of it?
I shared that yesterday, I think.
Oh yeah, my kids have had it. They've done it for a while. I think my boy, him and his friend compete to see how many food packets they can win. So a nice thing like that, instead of like earning Medit or something that's going to be, they don't understand, they earn food packets for kids in Africa that are hungry. So it's like a charity.
Wow,
that's
funded. Really cool.
Yeah, that's supported through activity of the kids, and they have a cheap, pretty.
That's so cool. I've never heard of that one.
Can you share that? You said it's in Slack, or can you post that? Because I would really love to look into that and see if we can even, I'm really active in the school systems here too. I would love to, we're always looking for new programs. You know, sometimes the fundraisers get stale.
I was talking to some of the people that work at UNICEF. They wanted us to push it through Care Docs because we're in all these K through 12 public schools. There's kind of laws against promotion, but
really,
you have to get the school to partner, and it's like a onesie twosie thing. But yeah, no, they're a great company. UNICEF Power Band. I didn't realize Fitbit was also kind of great, coming up with something similar. I think their band's pretty affordable. I'm not sure what Fitbit's is.
I think Fitbit was listed at $99.
Yeah, this one's
no Fitbit.
Yeah, so that's definitely more expensive than this one, but
well, adding to that,
it's gotta be pretty good. It's got to be durable if your kids are gonna wear it.
yeah, really. Adding to that, what are everybody's thoughts on tracking your kids through a Fitbit? Not like physically, like I'm talking about actually physically tracking them, knowing where they're at, almost like kind of like a life alert band. You know, it's like, do you really want to track your kids knowing where they're at all the time? But at the same time, yes, my kids hadn't got old enough to really where they start running around like that. But is that's going to become a part of the discussion on wearables? Is for kids, if they are wearing a device, should you have tracking functionality in there? I don't know.
Yeah, my sister-in-law does that because her daughter was in daycare and they were doing field trips, and she was young when they got it for, I think she was like 6, and she loves it. I don't have one of those, but I do know that people like the concept.
Be cool with it. I think it's great to know where your children are, and it helps you to maybe build a little bit more trust too, especially if you do send them out a little bit. I know in some instances you can't, but even too if you're just out and about in crowds or whatnot, you know, just it's an easy way to know where people are and how to find them in, you know, an emergency or something, or if you get separated. So I love that idea. I think there's multiple use cases, and I think that it's very beneficial, especially in for the time and mobile space and age that we live in.
Yep, that's kind of where I'm at.
The gamification thing, certainly, I mean, besides all the security stuff, which I think all parents are like, kind of wish they could have sometimes. at least. But the gamification stuff really works on kids. I just remember seeing them, whether it's our band or an app on my phone. If you tell them there's a score, so if there's like a Humantiv kid app version of it with a score, they'll just run at the dinner table and watch the score until like it moves. Like there's like, God, they want it to go up. Like,
hey, it's not limited to kids, okay?
Yeah, that's human psychology.
Yeah. Yeah. And they like to compete and just do that kind of stuff. But
so on that note, I want to segue into something else. Okay, for Humantiv, initially I'm going to go over our plans, and I think who would be the initial beta testers or use case for this tracking of score. So starting off, I think we are going to start with simple metrics to measure, and really not give somebody a health score over the first 6 months, and maybe just start getting all their data together and just tracking activity, tracking the steps, tracking your active minutes, tracking your sleep and your heart rate, stuff that you can automatically gather from Apple Watch or a Fitbit, the two basic wearables out there, and just use those metrics as far as if you get 10,000 steps in a day, you earn 100 Medit, something along those lines, where people can immediately see, all right, if I do this number of activity, if I do this in a day, I can get X amount of Medit. I can earn X amount of Medit. So having something that immediately hooks our initial users to see, okay, I can do this and get paid a cryptocurrency. That's awesome. That's what we're going to look at first, really to jumpstart the stickiness of this app, to get people coming to it, start earning Medit, and eventually earn that Medit and be able to spend that Medit in our Metaplex, which that can be another health talk. It will be another health talk, but it's an opportunity for people to use their Medit and purchase health and wellness services and products. So that's kind of the idea with that. And now an initial use case, let me get everybody's feedback on this because just still brainstorming on it. But Ben, what you were talking about, just seeing a score and competing against your friends with this. Now think about the CrossFit crowd, people out there that work out just about every day. They are very competitive. They compete individually. They compete against other boxes, the locations. They compete regionally, and there's a lot of competition every single day going. Every single morning there's competition. So what if the people that do wear fitness trackers, we can just track their score, and those guys can compete against other teammates, other people in the same class, or against other locations, or against whatever type of network they want to structure. So you can have these daily competitions based on just simple metrics. How many calories you burn. We can throw calories in there too. What was your heart rate, your heart rate variability, your steps, your distance, whatever that number, that actual metrics that we put together for that initial score. And people can just see their score on a leaderboard. And they know that I can beat this person over here and I can earn X amount of Medit. It's just a competition based strictly on scores.
Yeah, that's awesome. I think that's fantastic. Those are a really big deal here in South Florida. People are really into all of those gyms and working out, and it seems like there's a lot of different possibilities to partner with along those lines, whether it's a CrossFit or Orange Theory or whatever.
Yeah, just anybody.
I actually know someone that Orange Theory that maybe I think I'm actually going to see him this weekend, so maybe I'll run that by him and see what he thinks.
Be great.
Definitely, because I see it's low-hanging fruit for us, because you got these people that are already tracking their health. They already have wearables and they track this stuff. And there's other places where they can compete. Fitbit has leaderboards, but it's a leaderboard. What do you get out of that? Really nothing if you win. So having these people that are competing on a daily basis that are already tracking their data, it seems like a perfect use case for Humantiv. Now you can compete with a lot of other people. You can track your health a little bit better, and now you get paid to do so. So I think it's a win-win if we get the right.
Yeah, exactly.
If there's an opportunity, the company doing it really well, the whole leaderboard thing is Peloton.
Yeah.
The bikes at home, and I've heard they've had up to like 50,000 people in one session, all competing on the bikes, riding at the same time, and that's what people love about it. And that company's kind of taken off and going global now.
Adding to that, we've had this discussion before with Humantiv, with our Medit, our cryptocurrency, which I haven't mentioned much, but it's a standard ERC 20 token. It's a cryptocurrency that's going to be used as a rewards token, as a utility token within our ecosystem, and also as a token to be able to purchase health services. Well, also, we're going to open up this API for any other company that has a fitness app that gives users points. We want to allow them to use our Medit API, where instead of those points, they can offer our cryptocurrency as their point. So not instead of just a basic point, now they can have a health and wellness token that they can use to go purchase health services on Metaplex. So we're trying to create a large environment of other really app developers out there that want to develop an app. There's incentive for them to use our API because there's already a growing network of people using this. There's places to spend it, so they have more incentive to develop using this API. So I think that's a really good opportunity. And I talked to somebody from this past weekend. She has a WellStart. It's a chronic disease management app. And I asked her about their point system, and they incentivize their users to increase their or decrease their chronic conditions, just giving them points. That's it. I mean, it's just a simple, hey, you get 10 points today for doing this, and there's nothing else there. If they did say, hey, you get 10 minutes today, now this gets $10 off of your premium or your next doctor visit, or whatever type of procedure you might need. So now you're really creating a whole new economy based off of our cryptocurrency. So I think that's an idea that's going to grow a lot of legs. What do you think, Ben? I didn't talk to you about that earlier.
I guess the question, it's an awesome idea, man. I think the question would be, brands tend to care about their brand. Like Peloton, I'm just thinking of now, they're a very brand company. They sell t-shirts. They get people pumped about it. Do you care about the Humantiv brand when you're doing that, or would you almost let people white label it so it's their point and you're the system supporting it? But like credit cards, right? Every credit card has Banana Republic has a card, and this bank has a credit card, but it's really just the 4 major credit card companies running it all.
Yeah.
Like, are you thinking about it from a white labeling perspective, or you specifically want Humantiv brand out there?
No, I think this would probably be a white label perspective. I haven't really thought about that branding aspect, but I think Humantiv is going to be more of the operating system for everything that we're doing. It is that I do see it as being the software that a doctor runs when we start developing that out. It's the software that connects the patient to the doctor. And there's a lot that we see that we're going to do with Humantiv. I know calling it an operating system, that's more of an abstract term, but eventually that's where we want to go. So I think we'll probably get away from having Humantiv as that brand in terms of what you're referring to, and have this just as this is an open platform for anybody that wants to develop health and wellness software, apps, anything. They can use our open API to generate that rewards token for them. So it would still be called Medit, but that's something we can get down later on. But I'm open for whatever, really.
I got an idea here that's kind of a stretch, but I'm just wondering, all of these brands are for a particular niche population of people, which is fine. When I'm listening to what you're describing on incentivizing, somewhere that I see that really needs incentivizing, and this is across the board, across all financial brackets, across all specialties and therapeutic disease states, is really patient education materials in waiting rooms or in exam rooms. So there's a lot of information that's pumped out in millions, a multi-million-dollar industry, perhaps $1 billion. I don't know what the numbers would be on companies that are now trying to shift from print to digital patient education materials, but they don't see an uptick in people taking the information and going through it. How do you make it stick? I'm just wondering if someone was sitting in a waiting room and they have a tablet, or they have a smart device while they're sitting in the waiting room or in the exam room. If you told them, hey, if you go on this app and you read about your diagnosis, or here, why don't you sift through, a few options for treatment or what this procedure will look like, if you could start being rewarded. It could be an onboarding type program. Maybe they're not fully integrated yet into citizen health, but it's a way to bring awareness, and you're still incentivizing health because you're tackling that health literacy component and bringing awareness to the platform.
Oh, I absolutely love this. I can already see having a little display sit in the waiting room where that patient, of course, are sitting there for 45 minutes, an hour, and there's a little barcode or URL and it says, go here, learn about your condition, and take a quiz, earn Medit, something like that. And they go to it, and it's just a simple explanatory, this is your condition, and just give a background. A lot of people just don't understand the fundamental problem, like what is causing this condition. And
Correct.
Give nutrition advice, just basically sum it up. This is the problem, this is what's causing the problem, this is how you fix it. And just simple education, and then maybe have like a 5-question quiz into that. And then if they pass it, fail it, whatever that looks like, they can be rewarded Medit. And if they want to, they can take another quiz and another quiz and another quiz. So that education.
Well, here, and maybe each day that somebody, maybe the doctor's office can have a screen up that shows, in Dr. Smith's office today, here's the top scorers, and you can still gamify there. When I sit in waiting rooms with clients and patients and care partners, people are playing Candy Crush. They're playing all different kinds of things on their phone. Very few people are reading about their health situation. And there's tons of information that's being pushed into that space. I see that as a big opportunity because that's something that the people that are creating that content are really struggling with. So that could be a potential partnership or avenue to explore.
I like it. I'm all for education. I think, it's education first, and then it's nutrition and fitness, and that solves a whole lot of problems. Awesome. I like that idea. Explore that some more.
So now I'm just curious, if someone, let's say someone that goes to the doctor's office weekly and they earn their Medit, in theory, they could go into the marketplace and purchase medical supplies or prescriptions or, something that's relevant to their current situation.
Yep, that is correct. Because the idea here behind our cryptocurrency, Medit, is by taking these quizzes, you're getting smarter. Therefore, your health should improve a little bit. Like theoretically, if you go walk 10,000 steps, you should be a little bit healthier. If you take this quiz about your condition, you should be at least know a little more about being healthier. So as a whole, we're helping out the whole entire healthcare economy by being better. So if you're better, that value that you generate or that the Medit you generate is created by the value that you just created. So now you have that value in a token, so you can go and purchase a healthcare service, and it's just kind of all comes back together. Is you're creating value for the economy. That doctor gets this token, therefore this doctor can go back and purchase other services. So it's I like the idea of assigning value to this token that's based off of your activity, your specific activity.
And I think back to the idea of whether it's Humantiv or white label, we've been addressing that. White label, I don't really care what you call it, as long as it generates a Medit and they can use that to find value in what we offer on the Metaplex.
Mm-hmm. Yeah, that sums it up. I like that. All right, well, let me see here. When's our next? Okay, so we have Ben here. Okay, we have
Brennan. I can add one thing on the scoring to before we end that conversation. There are scoring things going on. So if you and Bill are thinking of starting to collect data from people, there's standard surveys that already create a score for specific things. Like if you've heard of the asthma control test in ACT, basically like a point system between 0 and 25 or 20 or something. And if they answer 9 questions, or something like that, it'll give them a score, and you can tell exactly how well controlled over the last 2 weeks someone's asthma is, for example. Mental health has a similar thing called a PHQ-9 survey. It's like 9 questions. So you might be able to create like a standard surveying mechanism in the app and be able to plug in these things that are coming out of the medical industry in each domain or each disease vertical. So if someone has asthma and they had a 19 ACT score, that's good. That means they're actually well controlled their asthma. So you don't want to ding them for having asthma. You want to actually say you're controlling your asthma well. So a chronic condition, managing it well potentially could impact the score, I guess. So there might be easy ways you can just piggyback off existing score surveys out there that make sense, and they're already basically clinically validated.
Yeah, you got a great point. And I don't know if you take a look at that link I just sent, that's the determinants of health I referenced earlier. And I think those same scores are what you just mentioned. If you look at the outer ring, that's where that would be. Let's see. That would be in.
Okay, so this guy may have those in there. That's good.
Yeah, if you take a look at like I said, the outer ring, that's all those surveys that you get this data from. So I don't know if that's in there, but that's the same concept. There are plenty of studies out there and questionnaires and different things that you could put in information and get a score out of. But then you got to start refining it down and incorporate all these other data points with that. Let me see here.
Let me say hi. Okay. Say hi, Paisy.
Hey there.
All right.
Hey.
All right. That's Paisy. I'll come in a minute then. Sorry.
Jackson and Nala are in the basement practicing.
All right. Well, yeah, that's, if you start looking at this, everybody take a look at that pie chart. I guess you call that a pie chart, whatever that graphic is. And, I mean, that's what we're working with. We're trying to look at that and optimize all of that. Sum it up. And that's a lot of stuff. But if you look at what we can affect, if you start looking at just individual behavior, you got your psychological needs, your negative mood, your sleep patterns, your diet patterns, physical activity, and a lot of that's what we're focusing on first: sleep patterns, diet patterns, and physical activity. Of course, it's kind of wide open. This is a fun time because there's nothing ever been done like this before. And heck, all these new wearable devices, they're just now opening up their API to get this data. So 3-4 years ago, it really wasn't possible to do this, but now it is. Let me see here. Is there anything else I need to hit on about this? I think we kind of covered everything about Humantiv and our initial launch and our beta test and kind of what we're looking at first as far as devices. Nabil, is there anything you would like to add?
No, I think we talked about the basics.
Okay. Yeah. All right. Is there anything else we want to add? Because I think this is it was a good recap on what we're doing.
We don't have to cover it now, but at some point it'd be great to understand how they actually spend this HSA Medit thing they've earned, and when they're using that, do you have to get the other side to agree, or the system's minimizing having to get other people to agree to accept payment of Medit? Or I didn't totally understand how the whole transaction will work when you actually want to use it.
Sure. Initially on Metaplex, it's going to be, we're not even really going to mention cryptocurrency. I mean, it's going to be USD. You pay your credit card, it's the same concept. You just buy it with your fiat currency, but at the same time, there's going to be options for a physician to accept. Let's say it's $100. They have a $100 charge for a one-time visit. That physician might be willing to accept $80 in cash and the remaining $20 of Medit value, or whatever that looks like. And maybe if they do choose to do that, we give them a bonus of 20% Medit on top of that to incentivize them to accept that Medit. And I'm thinking about with physicians to create a preferred token just for physicians, where this Medit can be converted into a preferred token just for credentialed physicians. And that preferred share will act as a stake in the network and a share in CItizen Health. So it will give physicians certain rights. So they will actually have equity in CItizen Health by accepting Medit. So that's the kind of idea that we're playing around with, but still that's nothing solid yet. But I think it's a good direction. If that answers your question. But we can talk about that later on and get to more specifics. But other than that, I've got a couple Medit tokens for sale right now. If anybody wants to go buy them, they're on some exchanges. I need to go check it. Somebody might have bought it. I think I set it like $100 a token just to do it. Might be $1 million richer. I don't know.
That's a great question too. What exchanges possibly would the Medit be listed on?
There's quite a few of them out there, but what it comes down to is just working out a relationship with them, and they're not just going to list any token. They don't want scammy tokens on there. They have to see traction, people using this, people exchanging it, activity. You know, and if you look at us, you look at our Twitter feeds, you look at these videos we're putting out there. Then once you start seeing Humantiv, the people actually generating the Medit, I think that's a good metric for these exchanges to look at. So, all right, this is good. We'll list this. Plus, you got decentralized exchanges out there where people can just post anything they want for sale. And if somebody hears about, oh, there's this new app out there that generates Medit, let me go get some of that. They can go and find it that way. So, plenty of different avenues. And I don't know if everybody saw that link I posted about the Reddit, the subreddit for Sweatcoin, and I mean that's the app I keep looking at for reference, because they're just tracking steps on your phone. They're not even using wearables, and it's not very accurate. People love it to begin with, but then hate it because it's not accurate and they can't do anything with sweat coins. And there's a lot of negative feedback. Like I said, also a lot of positive feedback. And those tokens, those aren't tokens. Those are just digital database entry points. And those are trading on the secondary markets, like people just saying, hey, send me this, I'll send you that. They're trading for anywhere from 2 cents to 5 cents a sweat coin. So if that leads you to believe anything, if these people are generating these tokens, they can just sell them, buy and sell for around 5 cents. And that's kind of the market price, what they set. But if you can redeem them for health services, the value is going to go up. So we're just going to let the market kind of play that out, see what they want to buy it and sell it for, and then kind of just go from there. All right, everyone. Well, I think we can call it a night.
Thanks, everybody.
Thank you all for joining.
Thanks, bye.
Thank
Have a good night, guys.
Good night, everybody.
All right.
Bye-bye.